Hello, everyone, and welcome to OurVentura TV. I'm Sandra Siepak. On today's show, our guests are members of the Parkinson's Association of Santa Barbara and Ventura. We have Lila Berris and her husband, Alan Berris. Thank you so much for joining us and sharing more about Parkinson's with us today. Lila, let's talk with you first. If you can share a little bit more about Parkinson's of Santa Barbara and Ventura and all that you do for many people here.
Well, there are different activities that we have. We have weekly support groups and biweekly exercise classes.
Okay.
And then there's a monthly support group for early stage Parkinson's. And then there's an annual symposium as well. It comes up often in the spring. And also speaker meetings that are monthly. So information, education is just so important.
Right, the education really makes a big difference.
It's changing all the time. The research is just, Michael J. Fox said 5 years. For a cure, yes. So that's, yes.
That's really good.
Yeah, and so there's a lot of support with the community. It's very busy doing lots of things, so it's great.
Well, both of you are a team effort here, so I'm going to, state that right up here at the beginning. Alan, you have been diagnosed with Parkinson's.
Yes, I was diagnosed in July of 2010.
Okay.
Over at UCLA, and it was actually kind of a relief because I was misdiagnosed first.
Is that right?
By a different doctor, and the drugs that they provided for me were horrible. And this one took me right in, took a couple of videos, and tested me with a particular medication that if it worked, I had Parkinson's, and if it didn't work, I didn't. And the next time I came back, he told me I had Parkinson's and that he was very relieved. And I said, "You're relieved?" And he goes, "Yeah, we can help you." And so that was great. And later on, I got the deep brain stimulation surgery, which really helps a lot of the externally visible symptoms a lot.
Exactly.
So I'm very happy with that.
So that really was very successful for you.
Yes, very successful.
And is that something you would recommend for most patients?
For many that I've met, I have recommended it, and they have done it, and they feel like they've been helped by it as well.
Okay. That's great. What were some of the early signs and early stages that you noticed?
I'm sorry. I didn't know that they were symptoms at the time, but losing a good part of the sense of smell.
Oh, really?
That I had. This was about 5 years before I was diagnosed. That was particularly distressing because I always enjoyed wine tasting. Okay. Which is smelling.
Sure.
So that was a problem. I developed a tremor in my left arm.
Okay.
And it was very mild, and it confused the doctors because it didn't seem like a typical Parkinson's tremor. And gosh, there were so many of them. My voice quieted down a great deal. Right now, I'm actually consciously focusing to make my voice loud enough.
Okay.
So I'm on several medications now in addition to the brain stimulation, and for the most part I do pretty well, but there are rough days. Some rougher than others. Today's a pretty good one though, and I'm glad to say
Well, I'm glad that's going on for you today because we want to present you in a good light here.
Thank you.
Yeah. And I think it's important because as you go through the diagnosis of Parkinson's and live with it, navigating Parkinson's can be a very challenging thing.
I call it, forgetting words, that's another one. I call it a very, very inconvenient disease or situation to have. It makes things take longer than they normally would. I have to plan ahead everything I do, plan ahead when I'm going to take my medications. And I won't say it's fun, but there are a lot worse things I could probably have though.
Right. And I think as a team effort, which you are, as a caregiver, I'm sure there are challenges as well. Let's talk about that too.
Yeah, because like I said, the changes, Alan said it changes all the time, so good days, bad days. And some days we sort of almost not totally forget, but things go nice and smoothly, and and sometimes it's weather, sometimes it's not. It's just difficult to say what causes it. So we communication is huge about what we need or what is going on.
Right. Now, for most people that are diagnosed with Parkinson's, there are, of course, symptoms to deal with, and then there are treatments. But I think one of the important things is to be educated and to be really aware of all that you can do for yourself when you do get that diagnosis. Is that true?
Yes, and that's why they have the monthly speaker meetings, because
Okay.
there's always new research. There are always new ways of exercise. One of the things they said with exercise is you need exercise there where you're paying attention to what you're doing. You're not reading on an exercise cycle. You're connecting your brain to your body exercise movement.
Okay.
And that's huge. And so, yeah, it's really important.
I think when you have a support group in place, which you have, tell us how, when you have that group in place and you get people to come in, what are the types of things that people talk about and are concerned about?
Well, some people are relieved, like the new people often listen first, and then they're relieved to hear, oh, that's what that was. I thought it was just me. And then sometimes if you're getting a little older, it's like, is it because I'm older? Is it Parkinson's? Is it something else? You know? And because there are all the motor issues, and then there are non-motor issues too. You know, some concentration, and sleep is a huge issue. Especially with medications, like 4 hours, and you have to get up for medications, or it disrupts your sleep, or you wake up suddenly and can't go back to sleep. So
sleep is an important part of dealing with it.
Yeah.
But it tries to escape you.
Is that right?
Sleep does its best to avoid my life. And there are nights when I'll be pleased to get 2 or 3 hours, and rarely do I ever get a full 8 hours anymore.
Really?
But I try to make up for it during the day. I've cut down on a lot of things because of it.
So many times people do take medications for the treatment of Parkinson's, and of course are a part of an exercise program or some sort of therapy program so that they can keep their life in check and balance and try to live as normal a life as possible. When you do that, I think it really matters, and it makes such a big difference for everybody involved. Would you say you can carry on pretty much throughout the day now?
Throughout the day, yeah, I can make it work as long as I get my medication right on time, every 4 hours or so. And the exercise is important as well, although I am somewhat limited because I have bad back, but I'm able to do core exercises, stretching, just can't do a lot of the more vigorous stuff.
Right.
Which is the stuff that helps the most. So
it is.
That's a little tougher for me.
So you find that that's something that, may be a little bit more difficult for you.
Yeah.
Okay.
Yeah. The other issue that would be helped more by exercise, if I could do more exercise, is balance. At night, I feel pretty at risk for falling and tripping. We've got extra night lights around, and we have adapted, but it's a challenge.
Right. It is. And what would you say you find to be the most challenging for you now in this position?
Probably the things that just keep changing. The medications change, and then, good days and bad days. And because, with all the support and the education, that helps to kind of keep moving in a good way. But then all the unexpected things, you plan this and you go, no, actually we can't do that because it's a day where that's not going to work.
Right.
Something like that.
So in this Parkinson's group that you have, a therapy support group, what are some of the types of speakers that come in? Doctors?
All kinds. Doctors, talking about people talking about exercise, people specialists, and neurological doctors, and people come in and talk about medicines, because there are so many aspects, to approach this.
Okay.
And so much research happening, So
one of the most interesting ones was this scientist doctor who worked on CAT scans and TOM scans, I think they're called. Anyway, they inject you with a medication and find out what's affected by it. And they're finding all kinds of amazing things at this point.
I'm sure they've come a long way from,
yeah.
Just even 10 years ago when you're diagnosed with Parkinson's now.
Sure.
You almost kind of feel relieved that you know what it is finally, so that, if you're struggling with some of these issues, you at least know what the diagnosis is.
That's a fact. That's absolutely true. And, it's the little things that add up and make for better days and a better life overall.
As a patient dealing with Parkinson's, what would you say to other patients who are now diagnosed and what they're going to be going through? Do you have advice for them? Do you have... views?
Go with the
about it?
flow as much as you have to.
Okay.
Don't try to fight it,
Right.
because that'll get you all depressed.
Is that right?
Definitely,
Okay.
yeah.
Right.
And depression is one of the things that will make things overall worse faster. So just, do what you can, be educated, follow it, read up something about it every day if you can, because as Lila keeps saying, there's something new every day. And just keep after it. And if you're depressed, call somebody, because it's not necessary. And this one, we've got a lot to look forward to, I think.
Right. Especially if you are, someone who is used to doing a lot of activity and is involved with your family, you really don't want to lose all that.
Right.
There are still things you're able to do. It's just a little life-changing here. It's not life-ending.
Yeah, that's very true.
Right. It just becomes something that you learn to navigate through, as we said.
And the resources, just the resources here in this area with Santa Barbara and Ventura, and then the website, mypasb.org has all kinds of information. They're always adding new information. So about activities and events and research.
And how did you find out about the organization? Did you?
Through my motion disorder specialist.
Okay, so you
She
were
told me
recommended.
about it, yeah.
Okay.
And they are incredible. They are there for you. They will take you under their wing as an individual till you get started in the group programs, and it's very gratifying. It's really nice.
And what are some of the things people can find on the website? What types of information is listed?
Like I said, you have all the events, all the weekly, monthly, and annual events. People host new research, exercise programs. There's also a boxing program that seems to be really helpful in town, in Santa Barbara. And just whatever new is happening, because new things are always coming up. So it's being updated all the time. It's not, this is the same thing 2 months ago.
Absolutely.
Kind of thing,
So let's share the website one more time.
So it's mypasb.org.
Okay, good.
Yeah.
Well, both of you have been extremely informative and very giving with your information about your own personal journey through Parkinson's. I think it really makes a difference for those out there who may be just getting that diagnosis and they're not sure of how to handle things. So thank you for sharing all that you've gone through.
Well, thank you for
Very
having
important.
us.
Right.
Yeah.
Thank you for having us.
So thank you, Lila and Alan Berris, for all that you have talked about. I appreciate it. And thank all of you for joining us today on Our Ventura TV. I'll see you next time, everyone. I'm Sandra Siepak. Bye, everyone.